Welcome to another podcast episode of Our Community. I'm Alfredo Diamond, and I'm here with a special guest, Carrie Miles, Neighborhood Health Center. Welcome, Carrie.
Thank you. It's great to be here.
Awesome, yeah. Man, it's cold out there. It's like Mother Nature just said, boom, turn the lights off. It's
Exactly.
freezing. Like, where'd this cold weather come from?
It is fall in Indiana.
Man, but I thank you for being here. So tell us a little bit about yourself.
Yeah, so I am born and raised in Cambridge City, lived my entire life in Wayne County and worked almost my entire life in Wayne County. Went to high school at Cambridge City, Lincoln, and graduated with a small class of about 72 or 3 of us.
Wow.
And have been here all my life.
Oh, wow. Have you ever had the opportunity to leave, or you just chose to stay here?
Yeah, we chose to stay here. We wanted to stay close to friends and family and the community that we grew up in, and it's been a really special thing to see our kids grow up in the community that we did. So very invested in our community and involved with various functions in the Cambridge City area.
In your position, you obviously went to college somewhere. Where'd you choose to go to school?
I went to Ball State. Chirp, chirp, right? So I went to undergrad at Ball State and then did my master's degree at Indiana Wesleyan.
We have a lot in common. I've got a master's from Indiana Wesleyan.
Yeah.
A master of science.
It was a great program. I enjoyed the faith-based part of that, and they really spoke to us a lot about being servant leaders, and I think was a great platform for me, as I became a leader in various organizations and various roles.
Was it the LEAP program?
It was, yeah.
Me too. Mm-hmm. Great opportunity to, if you got a family, you're working full time,
Yep.
and you continue your education. So it's a great thing.
Yeah, absolutely.
So Carrie, discuss your role in our community.
Yeah, so Neighborhood Health Center is a federally qualified health center. We provide holistic care for anyone in the community, but we're specifically geared to take care of those who need some extra assistance, whether that's financial assistance or help in their everyday lives in terms of being able to afford their health care, transportation to their appointments, and we provide primary care and mental health services in a holistic way. So it's a great place for patients to come to be taken care of for their physical needs, but also their mental health needs. And so my role, I was chosen as the CEO for Neighborhood Health Center back in 2017, made that transition. So that's been a great learning opportunity, and I've been able to really grow and develop an organization that I'm extremely proud of.
What makes the Neighborhood Health Center so special?
Well, I think there's a couple of things that really, separate us from a normal physician's office or doctor's office. We really provide comprehensive care. So we know and understand that we can't take care of a person's depression or diabetes if they can't get to their appointment, or they can't afford their health care, or they can't afford the medication to treat that. So it's a very holistic, inclusive way to provide health care that makes us very different. We work really closely with a lot of community partners. We're very blessed in Wayne County with a lot of great nonprofit organizations that help patients with a variety of different things in their lives. So we work really, really closely with other organizations in the community just to try to be that connection point for patients. And to receive patients from those other organizations. If they have a client or an employee that's really struggling, being able to step in and work collaboratively for the betterment of that individual.
What locations do you have? Do you have just one location, or is it multiple locations?
We have 3 locations here in Richmond, down on South A and 10th Street. Is here in Wayne County, and then we also have a clinic in Liberty, Indiana, and Union County, and then most recently Connorsville in Fayette County. We opened that clinic in August of last year.
And you're over all of those?
Yes. Yep.
What kind of struggles are you having in the workforce?
I'm going to knock wood here a little bit, Al. We have been incredibly fortunate to recruit and retain some really amazing people. We were really intentional when we were building our employment package for our employees that we wanted to find the right people and we wanted to retain them. So we sat down and met with every individual member of our team and just asked them, what's important to you?
Wow.
What types of benefits do you need to be supportive of your family and your life outside of work. And so, we really have worked really hard to incorporate all of that feedback into our employment package. And our human resources team has done an amazing job of vetting candidates and finding the right people with the right heart and the right mission to be a part of our team. And they've really invested into us as an organization. So we've really tried to kind of take things back to basics, that one-on-one relationship, not only with our patients, but with our staff. So we are really intentional about knowing them personally and knowing what their challenges are in their life and trying to meet those needs. So we've done a really good job of retaining. The other thing that we've done is work really collaboratively with area high schools and colleges to try to build that feeder program and that pipeline so that we're constantly getting great people into the organization.
Wow, that's major as an employer to open up and listen to what your employees have to say, potential employees. Can you share just a couple of things that really stand out to you that were kind of not necessarily eye-opening, but really kind of changes within the culture of the organization as far as what employees wanted?
Yeah, I think when you look at the data, and historically as an employer, you think about, long-term recognition being, starting at that year 5 mark. Well, if you look at the data, most patients or most employees don't stay in a job. 2.5 years was the average. So it didn't make sense for us to have a long-term recognition policy that didn't start until 5 years. So we start year 1. They receive an incentive after that. We really utilized paid holidays was one of the big pushes for our employees. Starting next year, they'll have an additional day that they can choose as a mental health day that they're paid for. But I think, generally speaking, that culture of wanting to belong to a small organization where they feel like they matter and they make a difference has really been the biggest kind of change from, like you and I, when I got out of college, I wanted to work for a corporation.
Yeah.
We wanted to work for a large organization where, we were part of something, corporately or bigger. We're really seeing that start to change with employees, and they really want to be part of a smaller organization with a really strong culture where they know each other and they have those relationships with each other.
Yeah. Where do you see the future of the workforce headed?
Well, I think we're going to have to continually make those adjustments as the workforce changes. There's much more focus on work-life balance, both with the hours of work, but also giving them tools so that they can turn off home when they get to work and then turn off work at the end of the day and be able to focus on home. So, the workforce is much different in terms of how they want to structure their life, and we've got to continually make those adjustments as an employer. I think the mental health component of the world really was escalated with COVID. So really being able to provide them those tools and those resources and that skill set to manage that mental health component is really important.
Sounds like you're an amazing leader and innovative, and it shows within your staff and your organization. So I think you're probably setting trends within your industry, and just keep doing what you're doing.
Yeah.
We're kind of break it up and go into a little segment that I've got called Hot and Ready or Cold and Steady. And so just a little bit of fun here. So just think about, our community and, what's your favorite park?
10th Street Park. It's right next to our clinic.
Okay.
A little known park. I didn't know it existed until we opened the clinic. But yeah, it's a great park.
Awesome. Are you a coffee drinker?
I am a coffee drinker.
Me too.
Yeah. Roscoe's.
Roscoe's?
Yep. 5th Street Bagel.
Yep.
Shout out to both of those.
Yep. Pizza place.
There's a lot of great pizza places. Probably Clara's.
Pizza King.
Pizza King.
Okay.
Can't beat Pizza King in Indiana.
Okay.
Yeah.
Which local business comes to mind for ice cream?
Ollery's.
Ollery's?
Has to be. Yeah.
This is a tough one. It's a tough one. Favorite place for dinner?
I'm going to shout out to my hometown, Number 9 Grill.
Number 9 Grill? Like Number 9 Grill.
Yeah, you can't beat the Number 9. Lakeview.
What's your go-to meal there?
Barbecue chicken salad.
Nice.
It's great.
All right.
Salmon. You're making me hungry.
I know. It's too early. I know. I got to fast. I can't eat till 1 o'clock.
Yeah. Oh, yeah.
Yeah.
It's a long morning.
Yeah, it is. I got to power through it. With local business education and business development in mind, where would you like to see our community within the next 5 years?
Well, I think for this community to continue, and I think we've made some really good strides, and I think there's some great conversations being had in the community. How do we retain some of these young people? How do we keep them invested in this community? How do we help them, establish roots here and not migrate out? I think we've got some great programs that have been started. I think there's a lot of movement because we know we can't continue to watch the outflux of the population. So I think showing them, the opportunities in the organization and in the community is really important. Being invested in that education component. It takes a lot of time as an employer to have interns, but I think every organization that's doing business in the community has to invest in that if we want them to stay here, and we want them to realize what opportunities are available.
And that's something that's important to me with my roles in the chamber and at IU East, and just passionate about retaining our education. I think it starts, at the school and bridging that gap with employers now. I mean, what can you share maybe an idea that you have to help us bridge that gap?
Yeah, we've had a program started the last couple of years with Lincoln. So we've hosted 2 of their high school seniors for work-based learning. So it's a great opportunity. We get funding back through the Earn Indiana program where we're compensated for part of their salaries. But this year we have a senior coming out of Lincoln High School. She's with us, 4 days a week, about 4 hours a day, and she's doing some tremendous work. And she's one of those individuals, she has no idea what she wants to do with her life. She doesn't necessarily want to go into healthcare in terms of nursing or medical assisting, but she's got a lot of great ideas for marketing and blogging and vlogging, which she had to explain to me. I thought that was a typo. But she's going to start doing some work for us, which is something that we need. We don't necessarily have a full-time position for marketing or really able to afford a full-time position for marketing. So it's a great way for us to give her some real world experience and for us to get, some manual labor, at a lower rate. So just those kinds of things, but it takes time, right? Like there has to be somebody in your organization who's willing to meet with that student every day and provide direction and provide oversight. So having people on your team who are invested in that. And so we're very fortunate that way to have people that want to invest in those students.
Can you share a memorable moment or experience with your involvement in the community that stands out to you?
There's a lot of great moments, I think, that are going on. I think to see this community come together, last year with Sierra Burton and that tragedy was really special to see that the connection in the community and to see organizations and individuals support our law enforcement. I think COVID brought a lot of community members together. There was a lot of really good things that came out of COVID. Being supported, from a healthcare perspective by the community was unbelievable. And to see the community support teachers and various people who were impacted with the pandemic. So I think there's a lot of really great movement that way and a lot of connections in the community that make it really special.
Well, Carrie, what advice would you give someone else out there that's kind of, they're trying to figure out how to get there, share their experience within the community, find out how they can help? I mean, what would you suggest to someone out there that's kind of on the fence about just kind of taking charge and helping out?
Yeah, I think the first step is to figure out, kind of what sector you want to be involved in. The United Way is a great resource. They're involved with so many different organizations in the community. Places like the Natco Empowerment Center, they do poverty simulations, which is really important, especially for leaders in the community to understand some of the challenges that a large percentage of our population deal with. But just making that first connection and just showing up to events. I think there's just such power to that, being present, being there, being available if someone calls to make those connections is crucial. I fervently believe that the world revolves around relationships. And so, all you need is one. You just need that one relationship. And then that person can really bring you into their world and make those connections with other organizations just to get started. There's just so many great organizations to get involved in, whether that's, the chamber or the foundation or so many nonprofits, Boys and Girls Club, Girls Inc. There's so many nonprofits who are looking for governing board members. That's always a struggle, is trying to find people who have capacity to be involved and the time to volunteer to be a part of those. But great things happening with some of those small nonprofits.
Are Are there any upcoming projects or causes within the community that you are particularly excited about? You want to share?
There's a lot of work being done in regards to homelessness. I think if you're driving down, US 40 and in several different places in Richmond, you're going to see that struggle. So there's several groups who are working on, how do we start to combat this and what resources do we need and how do we come together? So that's been an exciting kind of turn of events happening. Again, I think some of the work that Forward Wayne County is doing in terms of working with students and individuals to keep them invested in the community is really exciting. So yeah, just a lot of really good conversations going on and some work being done.
Well, you're so involved. So think about your staff, special person, team members, or anyone that you would like to shout out today.
Every individual that works at Neighborhood Health Center, we have been incredibly blessed with some amazing people, but also just the opportunity. We talked a little bit about governing boards. We've got an amazing governing board. They donate a tremendous amount of time to help us keep, the wheels on the bus, so to speak, and are just really invested and great advocates for us out in the community with their local connections. And so a big shout out to our employees and our governing board.
Shout out to our employees in the government.
Yeah.
Well, that closes out another episode of Our Community. I want to celebrate and thank our special guest, Carrie Miles, for joining me today. And look forward to maybe having you back on down the road sometime. And thanks. That's it.